So, Professor Lo, with all these precise measures in place, including the health code you have mentioned over the weekend, what can we expect, especially from the investors, international financial leaders? You know, can they? Are we asking in exchange for a shorter quarantine, or even they can, you know, press ahead with the international financial event to be organized in November? Under the one country, two systems, can Hong Kong come up with our own zero strategy?
Definitely. Our current direction is to make sure that all the measures we are introducing are precise and directed at promptly identifying those who have the virus, and then letting the remaining people who don't have any risks of infection to return to more normal life. This actually includes our recent measure of suspension of the so-called circuit breaker. And the circuit breaker is a very indiscriminate strategy to stop not only the infected but the non-infected majority. Now, with all these measures in place, which I would say would not increase the restriction for the general public, we are hopeful that we will be able to reduce some of the other measures which are restricting especially our international travelers. For example, we are considering if we can have the yellow code coming out and getting into action, we will be able to reduce the designated hotel quarantine measure. I certainly understand this is a deterrent for many of our international travelers and also our home citizens who want to return home. And that's the reason we are looking at the data. We want to make sure that it's evidence-based by introducing measures which can actually continue to maintain prevention of the COVID from spreading into the community. We can actually relax the restriction on our travelers. We are considering every option, and the current data is very positive. I'm quite optimistic that we'll be able to reduce the designated hotel quarantine to a certain degree. I can't say for sure now. We're waiting for the PCR result on day 3, but it will be a significant reduction. And we are considering every option, 5+2, 3+4, or even 0.7 in future, if the data support a new policy.
Regarding the health code system, are we copying Macau's model? And right now, if we look at the Macau situation, it seems that even more restrictive measures cannot reduce the infections very effectively. What's your take on that?
I never copy others, even when the very first day when I'm a student. I only learn from others. Now, the health code is an important strategy to risk stratify different people and to identify them. Our whole purpose is not to track them. We only want to identify those who are really at risk. I think everybody would agree that anyone who's infected, who's got a positive PCR test, should refrain from getting into the community, into this high-risk area. So giving a code will let people recognize them and to ensure that they would not endanger the others in the wider community. So, and Hong Kong and Macau are very different. We are different in the size of the population, in the age distribution of the population, in our vaccination rate, in the fact that Hong Kong has already gone through the fifth wave of the COVID outbreak, and also in the sense that Hong Kong is a very international city, very different from Macau. We have different needs, and also our starting point is different. Macau's starting point is from 0. They have 0 infection for a long time. And they want to maintain this 0 infection, not a single community case. And that's why they use the health code in a different way. But for us, our starting point is we now have 3,000 cases a day. And by introducing this health code, the concept, but the exact definition of a red and a yellow is very different from Macau. We would be able to reduce the cases. The whole idea is to get to a R0 less than 1, which means that we always go towards reduction rather than addition. Our whole purpose is the direction. We want to have the right direction, that Hong Kong, the COVID is under control. When it's under control, the number of infections should be reducing rather than increasing all the time. That's the whole purpose. Right now, we are definitely quite concerned because the number is still increasing, and there's a projection that the cases may double within 2 weeks. And that would lead to a very severe pressure on our healthcare system. We want to ensure that, as the government, we must make sure that we protect not only the elderly in the old age home, but we also protect the patients in our healthcare system. The COVID outbreak, when it gets to a point, if the cases, there are so many cases, it will overwhelm our healthcare system. So it's not just the COVID patients who will suffer and die. There are all the non-COVID patients, patients with heart attack, stroke, cancer, and even other diseases like a hip joint replacement surgery. The service will be reduced. Our hospital authority colleagues have projected in the worst case scenario, if the current surge of cases continues by the end of this month, we will be facing the chance that in this worst scenario, over 2,000 beds being used, which means 10% of our public hospital facilities will be used to treat the COVID patients. And together with the possibility that a high proportion of staff may get infection again, we will be facing a 25% reduction in service, which is very significant. You know, Hong Kong, the public service, there's already a very long waiting time. And so this is something we don't want to see. That's why we have to prepare for the worst, but then do our best to make sure that the worst would not happen. In the 25th anniversary of Hong Kong SAR, President Xi has made a very clear statement about this. In his 4 necessity for Hong Kong, the 4th point is actually that Hong Kong must continue to maintain the one country, two system, and it has to maintain its position and its advantages, which means that Hong Kong is actually a very international city, as an international hub, and more importantly, it's a window. It's a window for China, for mainland China, to interact with the rest of the world. And in fact, in this COVID pandemic, anti-COVID measures, we can also serve as a bridge. So our mother country doesn't actually require us to follow exactly what China is doing, what our country is doing. That's for sure. Now, over the last 2.5 years, our anti-COVID measures are different. So it's not realistic, not practical to expect that we can copy the same system in China within a short time. But we have to learn from the mainland measures, and we want to make sure that we serve as a bridge. So Hong Kong will continue to implement effective measures to control the COVID, and the eventual target is, with more precise anti-COVID measures, we will be able to control the local outbreak, and at the same time we can get connected to the international arena as well as get cross-border travel back to mainland China. This is the ultimate target.